The next thing we're going to talk about is what's called a partial birth abortion. If we can't get the nation and our legislature to understand what's really going on here, we're never going to have any kind of an impact. Partial birth abortion can be performed at any gestational age, okay? You know, we talked about Roe versus Wade and all the things that came into that. You know, there are so many things that, when you think, you know, you can do this procedure if mom's health is in jeopardy, you think, well, you know, I guess if we don't do this, mom dies, that means her health. Health is defined as physical, emotional, psychological, age, familial. So just not anything too young, too old, anxious, depressed. Any of these things can be considered health and have these procedures to be performed. But with a partial birth abortion, the baby is there up on the inside and the baby is alive. All right. They will then use an instrument. They dilate the cervix. Sometimes it takes a couple of days to open up the cervix enough in order to deliver the baby. And this can be done at any gestational age. But what's done is then the baby's foot is grabbed up from the inside and it's brought back down. All right. So we're essentially delivering this baby breech. All right. And when the first foot is brought down, the baby is still alive. They then reach up and they'll deliver the second foot and the second leg. Now they have a good grip on the baby, and baby's alive, and baby's, you know, moving around. Then they'll put a little bit of traction on. They'll start to bring the baby down a little bit more. And as they're bringing the baby down more, the arms start to come into view. And they'll reach up with one finger. They'll grab the right arm. They'll sweep it down, and they'll deliver the right arm. Then they'll rotate the baby around, and they'll deliver the left arm. Now at this point, 90% of the baby is on the outside. You know, the baby has already completely left the womb and is beyond the cervix, and it's just the baby's head that's sitting there still in the vagina. Legally, the baby is not born yet. All right, the baby hasn't taken its first breath. The baby's alive, moving, doing its thing while it's being held in the doctor's hand. And I use the term doctor really loosely, but the baby's being held right there. But what they need to do now is they need to, you know, do the abortion procedure. They need to kill the baby. And the way they do that, it's one of the more common ways, is they'll use a pair of scissors like this. Now, you remember from your biology class, remember the foramen magnum, that hole in the base of the skull where your spinal cord comes down from the brain into the back, into the spine? This scissor is then placed at the base of the baby's neck, at the base of the skull, and is forced up into the baby's skull, into the baby's brain cavity. And then the scissor, you know, is opened up just like that to expose that area. If this doesn't kill the baby just by doing that, then the thing they can do is they can then take a suction curette, place it up into the hole they just made, up into the baby's brain, and then turn the suction machine on. Just like it crushes a steel can, you can imagine what it does to the baby's brain up there on the inside. Once they've done that and they've killed the baby, which now of course stops moving, then they'll deliver the rest of the baby, you know, dead. But that's when you hear partial birth abortion. You know, there's no way that part of the procedure, yes, there are some reasons where we need to deliver babies early. When moms are sick, and the only way we're going to get mom better is by delivering the babies early. But to deliver the legs, the belly, the chest, and both arms of this baby, and then kill the baby at that point, how does killing the baby at that last second protect the mom at all? It doesn't. You know, it's just a way of being able to justify in somebody's head killing babies at any gestational age, whether it's the first trimester, the second trimester, or the third trimester. But that's what a partial birth abortion is. When it comes up in the news and it comes up, you know, in the legislature, that's what's really going on. Just picture that. I mean, babies that would do just fine. We have babies that do well at 23, 24, 25 weeks at our intensive care nursery, and we have great survivals. I mean, these are babies that are even further along than that. But all they need is just let the head come out, clamp the cord, cut the cord, let the baby go to the nursery. Okay? Those are first, second, and third trimester abortions.